This will likely be the hardest wave of the pandemic. That coming from the Ontario Science Table. New modeling shows that without strong additional public health measures, in about 2 weeks from now, we could be seeing 10,000 COVID cases a day with an unsustainable number of patients in the ICU by the early new year.
Waiting to take action means waiting till it is too late to take action.
A circuit breaker approach is what the Ontario Science Table is recommending, as Omicron is now believed to be the dominant strain here in Ontario. Dr. Steiny Brown says we need to cut our social contacts by 50% to allow for more people to get booster shots and for kids to be vaccinated.
If we want to blunt this wave, and please note that I'm saying blunt it, not flatten it, we will need to reduce contacts between people. I believe we can do this without closing schools or shutting down businesses that have suffered during previous waves. But it will take serious restrictions that reduce contacts. This is a hard decision.
While the province is reducing capacity limits by half at larger venues like arenas and concert halls, modeling shows that doesn't go far enough, with other busy public settings like malls, restaurants and gyms still operating at 100%. Yesterday, the Premier was asked about the possibility of further restrictions.
Locking ourselves down out of this isn't the solution. What the solution is making sure everyone goes out and gets a booster shot.
While the Science Advisory Table is not suggesting full lockdowns, the data shows we could be seeing 10,000 cases a day and 600 patients in the ICU by New Year's Eve. But those numbers could be cut in half with stronger public health measures. Dr. Brown also says there is growing evidence that Omicron does cause serious disease.
Hospital rates have risen in South Africa, where it first took hold. It's not just a case of the sniffles.
The number of people there in the ICUs and on ventilators is also on the rise, and Dr. Brown notes that the population in South Africa is younger than Ontario and has a much higher rate of immunity due to vaccines and previous infections. Early Danish data also suggests that Omicron is just as severe as other variants.
Our modeling also shows that whether it is as serious as Delta or 25% less likely to produce serious illness, our hospitals will still face incredibly strong pressures.
A statement from the Minister of Health's office said that the capacity limits on larger venues announced yesterday were not factored into today's modeling. It also reiterated the government's plan to get 200,000 to 300,000 doses of vaccine into arms every day. Now, we did ask again if more public health measures are being considered. We were being told that the Ontario Medical Officer of Health will continue reviewing data and will act as necessary.